Hey everybody, today is June 6th. I am 1 week post-op, having surgery performed by Dr. Illan in Tijuana, Mexico through BariatricPal. In this particular session, I'm going to talk about what that experience was, talk about the hospital, the facility, the care, the caregivers, and I'm also going to just kind of do a play-by-play of like what happens when you get off the plane and get there, and just what that experience is. So I flew in the same day I had surgery and left from Salt Lake City, Utah, and so that's a 2-hour flight. At the same time, knowing I had to go through all the the pre-op testing and x-rays and all that stuff. That all had to happen before the surgery, and I knew the surgery was going to be in the late afternoon, sometime after 3 o'clock and before 6. That really made me nervous. Some people fly in the day before just so that they can stay on their clear liquids all the way for a day and then go in the morning like you would in the US traditionally. Several patients do that. I wanted to just do it the way that they suggested I do it, and actually it was really, really easy. Just making note that when you do your pre-op diet, you're on liquids only. By the time you get around to a flight in that day, your body is used to running on almost nothing. It was almost unnoticeable how easy it was, because normally I wouldn't eat anything anyway, and the only thing I was doing is just not drinking. But it actually had some benefits too. I'm kind of a nervous flyer, and if I, most of the time when I wake up the morning of a flight, sometimes I have some issues with food I've eaten, we'll just call it that, some digestive problems. But I didn't have any of that because I was on a liquid diet, so I wasn't stuck in the bathroom or anything in the morning. Didn't have any stressful side effects. I just went to the airport, jumped on the plane, and when I got there I didn't feel like I was hungry or anything. So I think that was just a non-issue. I don't know if anybody's ever worried about that, but that was a non-issue for me. So we arrived, my wife traveled with me, by the way. We arrived in San Diego at about 10:40 in the morning. We were picked up by our valet. They picked up ourselves and one other patient that we became friends with, kind of why we were there, that traveled, that arrived at the same time, and so we jumped in their Chrysler van and then headed for the border. Pretty quick and painless process, and it was really nice. Again, I'll probably talk about this again later. It's really nice to not have to worry about the rental car and being picked up, especially when you're dealing with another country. It was really, really comfortable just to jump in a van with somebody who knows what they're doing, who does this every single day, knows what lane to be in when going into Mexico, and knows how to do it quickly, and just that whole process is a wonderful process. So anyway, we drove. It was probably an hour drive. It really would only be about a 15-20 minute drive from the airport, but you have to wait to cross into Mexico and go through the checks and stuff. We did not need our passports for that portion of the crossing. We did need them coming back, but not for that. So we crossed into Mexico. About 10 minutes after crossing the border, we arrived at the Oasis of Hope Hospital. If you look at where that hospital is on a map, it literally is about 200 steps into Mexico from the United States, if you look where the border is. And it's a very beautiful hospital. On the outside, when you kind of come in through, into Tijuana, it's kind of this weird little beach location. It's an older area, but some of the neighborhood around it's a little run down. Not by any means threatening or dangerous feeling. It just kind of has kind of a cool little Mexico kind of feeling to it. But you pull up and there's like a gated thing, and there's a guard there, and they let you into these gates, and you go in. There's a beautiful courtyard and the fountains and the things that you've seen on their website. Anyway, we were escorted the entire way, again by the valet. The valet took us into the hospital, and the entire kind of bottom floor of the Oasis of Hope is leased by BariatricPal. So Carlos and Alexandra, I think I'm saying her name right, could be Alexandra. Anyway, they greet us there. They throw some paperwork in our laps. Smiles, handshakes, just very warm and welcoming group of individuals. You fill out your paperwork. They take you back to the rooms, and the place is really, really clean and nice. You go back to your room, and the bathroom's nicer than a Marriott. It's all modern tile, all this new gray contemporary stuff. Everything's super clean and like taped. The toilet seats are taped closed, showing that they've been sanitized and steam cleaned and everything else. The room itself is clean. It's fairly simple, but it's very clean. There's a leather couch that's a futon that your companion will probably sleep on for a couple nights while you're there. But very, very nice room, very comfortable and modern. Anyway, they don't waste any time. Nurse comes into the room, takes 3 vials of blood for some tests. They put you in a wheelchair and they wheel you back to an X-ray room. It's probably the only room in the whole the whole hospital. I almost called it a hotel because it felt like one. But the only room in the hospital that seemed a little dated. You go into this old X-ray room, but everything else was really modern. Anyway, they do chest X-rays. Back to the room. A guy comes in and gives you a really quick EKG to make sure your heart's in decent shape. And then they come in and they give you your IV. And there you kind of sit. You don't really. I bet if I asked, I probably could have got more info, but I didn't really know when my turn was. I just kind of sat there and laid in the bed for about an hour. Just me and my thoughts, and my wife trying to keep me preoccupied. So after about an hour, gurney shows up outside the hotel, not the hotel, the hospital room, and you jump on the gurney. They put a little powder under your tongue. It just relaxes you, I guess. I'm not sure what it was. I didn't notice a whole lot of anything after they gave it to me, but I actually wasn't all that nervous. I'm actually a very nervous person, but the place has a very calming effect. Everybody's really, again, they're just so nice there. So they wheel you down the hall, put you in kind of a waiting, I think it's really the recovery room while you prepare. Dr. Illan met me there, great spirits, big smile on his face, and just really put me at ease. And the guy is a master. He's an artist when it comes to this surgery. And I might even talk some more about it. Maybe I'll even talk about it now just a little bit. We'll do it another time. But definitely a best-in-class surgeon. But one of the things that people wonder is the quality of the procedure as good in Mexico? And it needs to be said that not only is it as good, but Dr. Illan uses techniques that are better than what most doctors use in the United States. He uses a couple techniques where one, he follows the curvature of your stomach when he does the procedure, and then he also does a procedure that's called inverted corners or inverted ends. Some people call it an inverted VSG. And really what that is where you take the suture line of the procedure, and at the very end, after it's been stapled, that suture line gets pushed in by using it's a suture technique, and it pulls that seam inside. So what you end up with is you don't end up with this acute angle inside your stomach that creates a bunch of pockets of acid and acid reflux and stuff. So statistically, if you didn't have acid reflux before having the procedure, you shouldn't have it after, when some of these really advanced techniques that Dr. Illan uses are employed. And I will tell you, now that I'm 10 days post-op, I have less acid now than I did before. I didn't have acid reflux before, but my acid levels, I've not had even an ounce of acid reflux, not a bit, since post-op. Granted, I'm not eating normal foods either, so we'll see how I'll bite my tongue and not talk ahead of class, because I don't really know what the long game is. But anyway, best in class procedure. He was fantastic. I went into the operating room from there. They have you kind of scooch off your gurney onto the operating table, and then very comfortable, lights out. Next thing you know, you're waking up in the recovery room. I was the only of 3 patients that had the throw-ups, and I'm not even a throw-up person, but as soon as I woke up, I felt this urge to vomit, and I threw up probably a tablespoon or 2 of blood. It's very common. It's normal. I wish I could have been one of the other 2 who didn't have those problems, but anyway, that was my recovery, waking up. Shortly thereafter, they wheeled me back to my hospital room where my wife was, and laid in bed, and it was kind of rough. Everybody will tell you that first 12, 20 hours is really rough, and it wouldn't have been so bad if it wasn't for the nausea, but it's okay. The nausea, sometimes when I was throwing up, it was actually kind of nice, because then I could burp some of the gas they fill your system with, for both the leak test and when they're doing the abdominal CO2 stuff. A lot of that's coming out, and that was a relief when that would happen. And I was kind of nauseated on and off. They didn't even give me ice chips, just to kind of let me get over it. I came out of the procedure at about 5 p.m. and I was nauseated till about 3 in the morning, and didn't sleep much during the night. While the others were sleeping restfully in their beds, I was in there still trying not to throw up most of the nights. I had a really rough first night, but the nurses were awesome. They were in there. They took care of me. They'd bring me new little, moon-shaped dishes to throw up a tablespoon of blood into, and it was old blood, right? It was, but and it wasn't that bad. It's not like the whole body wrenching thing that you have when you have the flu. So day 2, I woke up. They are giving me ice chips. Probably only had about 3 hours of sleep, but I was able to suck on ice chips at this point. All the throw up stuff was done. They came in, gave me some blue liquid for the leak test that was about to take place. Go back into that same x-ray room. They put another liquid. Not everybody gets the 2 liquids. I had it because I had a drain. It was one of the 3 of us that had a drain. Sorry, of the 3 patients, I was the only one that had a drain. Let me say that correctly. And if you have a drain, then you have to do this blue liquid too. These are the liquids for the bariatric test. What do you call it? It doesn't matter. The leak test. A lot of people say how terrible they taste. They don't taste that bad. In fact, they're almost flavorless. There's a little bit of a strange taste to it, but it's really easy. Did the leak test, passed. And back to the room. About 30 minutes later, the famous tray shows up, and it's got Jello and apple juice and Gatorade and some water on it. And the first thing you notice is immediately they want you to start drinking, and you realize that there's just not very much that's going to go in. I took a sip of apple juice just to get some calories in my system, and the experience is kind of, you're noting your stomach is inflamed. You just had surgery on it, so it's as small as it's ever going to be, and everything's kind of swollen. And so you take, maybe a tablespoon of this apple juice in, and you can feel basically the bubbles as the apple juice is going in, and the air that's in your stomach is exchanging places. It kind of gurgles, and that's kind of how you start, and you're just doing like a tablespoon of fluid at a time, and you're trying to do that all day long. And again, I think I probably had a harder time than the other 2 patients. I only got in about 15 to 20 ounces that entire day. But noting at the same time, you're on an IV and they're giving you fluid. So if you're going to have a day where you just are not that successful, that's the day to have it, and that's fine. Also note that in the United States, they're already throwing you out of the hospital after that first night. So you don't have an IV to rely on. You don't have anything else. They just want you out of there so they can get another patient in and make a bunch of extra money. But you get 2 nights when you stay with BariatricPal, which is great. So all that second day, walk. They want you walking because that helps get the gas out. And as you walk, you kind of burp and get some of that out, and it feels really good. That day was kind of rough based on not a whole lot of sleep. And then at the end of that day, again, I had a drain. Doctor came in and pulled the drain out. It was painless, comfortable thing. They certainly know what they're doing when they're doing kind of the same procedure and maintenancing. You know, the caregivers are helping people with the same procedure every day. I think they just really know their stuff. But I crashed that night. I slept, and I slept through the entire night, and I slept fairly comfortably. And the next day was great. I'm going to end this session right here, and so I'm going to do a part 2 of this to talk a little bit more about the hospital, because I realize it's been about 15 minutes, and YouTube's going to cut me off in 5 minutes. So part 2 coming up, and we'll part 2 we're going to be talking a little about day 3. We're going to talk about some of the care at the hotel, some of the sightseeing stuff that BariatricPal does. We'll talk about the valets, and then just kind of wrap up the whole experience. Anyway, part 2 coming up. Thanks.